and welcome to this special COVID-19 vaccine online informational session for our Kaka'ako residents and Kamehameha Schools commercial tenants. My name is Mei Nishimura, and here with me today is Aaron Dote. We both are representing Kamehameha Schools communication team for our commercial real estate division, and we will serve as your moderators. Thank you for joining us to learn the latest information on the COVID-19 vaccine in Hawaii, including local coronavirus statistics, vaccination benefits, safety, efficacy, availability and prioritization, and the facts about the latest strains of the virus.
Aloha and thank you, May. This session was created for the our Kaka'ako residents and our commercial tenants. And we would like to thank the Kaiolu o Kaka'ako Owners Association for sponsoring the event. Today we have a great list of presenters today, including Lieutenant Governor Dr. Josh Green, and from the John A. Burns School of Medicine, Dr. Sandra Chang, a professor and graduate program chair at the Department of Tropical Medicine and Medical Biology and Pharmacology. Later we'll be joined by Jordan Lee, who's a 2000 Kamehameha Schools Kapalama alum and Kaka'ako resident. And he is a Queens Medical Center pulmonary care and critical care physician. Attending later on in the conversation during our question and answer will be Dr. Lee Banukute alum, the Associate Dean of Academic Affairs at the John A. Burns School of Medicine. Before we begin, I would like to go over a few housekeeping items. Today, our attendants are in listener-only mode, but please feel free to ask any questions in the chat, and we'll get back to them soon at the end of our session.
As Aaron mentioned, please feel free to submit questions during the presentation in the Q&A box. And for those of you that are joining by phone, you may email your questions to us at info@ourkaka'ako.com. Due to the number of participants, we may not be able to address all questions during the Q&A period, but we'll do our best. We'll address the issues of common concern to the entire group. This session is being recorded and the video will be shared on the Our Kaka'ako website at ourkaka'ako.com and Facebook page following the session. Now, it is my pleasure to introduce Lieutenant Governor Dr. Josh Green to provide the latest coronavirus statistics and updates on the vaccine.
Hello, everybody. Thank you for including me. I'm going to share my screen here. Jordan's going to help me. Magic. Here we go. Just went away there. Okay, can you see me okay? There we are. And you guys see my screen and everyone hear me all right? Okay, great. So thank you for welcoming me. I'm going to run through a couple things, but before I get into the specifics about the vaccine, I'm going to also give you a kind of an overview of where we are in Hawaii. We only have 17 cases today, which I'm happy to report, 17. It's obviously been a really good process. We're seeing the numbers plummet, and our positivity rate has dropped down to 1.01%. So we're seeing an utterly low percent. Our active case count continues to drop, and our hospital case counts are at a first time under 40 count since back in July. So we're seeing the COVID pandemic recede in front of our very eyes, and it's mostly due to people's hard work and the vaccination process combined. So those numbers are exceptionally good, whereas the country is also starting to see a decline, but they still have a lot of pretty serious challenges. Now, here's a reflection of where we are right now. These are the latest data that we do, that we have to compare to the nation. You can see that we have the lowest infection rate now, confirmed infections per 100,000 people over the last week. Historically, it's been either us or Vermont have had the lowest, and we've had 46 infections per 100,000 people over the week. Really low rate, and that's good news. Only perhaps topped that by, here's the whole, by the way, the whole pandemic. They're basically tied with Vermont for the lowest rate of COVID in the country. But even so, it's taken its toll, and it has created some heartache. As you know, we've had 426 fatalities of people who live in Hawaii. So disproportionate amount of cases have always hit our Pacific Islander community. That's also been a great challenge because families live in multi-generational households in some cases at a higher rate. And there have been some cultural differences. For instance, some of our communities have very vibrant end-of-life celebrations, funerals, and what have you. There have been some spreader events associated with our cultural practices. So it's been a challenge, but we've done very well compared to the rest of the country. Here you can see that Hawaii has had the lowest death rate over the course of the pandemic, particularly this last week, lowest in the nation, 0.6 deaths per 100,000 people. As you know, we have 1.4 million people, and they've continued to have fairly high mortality rates in a lot of the cities with urban centers. Though you can see also some rural states have had moments where they have had big outbreaks and spread. And we can get you all these slides. My team will send them to you. Jordan's been terrific to put all this stuff together. This in spite of the fact that she's like 9 months and 3 weeks pregnant. So she's there. She's over capacity for pregnancy. So she's doing a great job, for real. Okay, so there's the entire measurement period from March 7th through February 6th, essentially a whole year. And we've had, this is the mortality picture, the death rate per 100,000. And like I said earlier, basically the same as Vermont and Alaska, very rural states with low populations. So we've been, I would say, lucky, except actually it's been also good. We've worked really hard to do this and to make sure that we don't have much COVID. Now here's where we were January 5th versus February 15th over a course of 40 days. You can see that we had 105 people hospitalized back on the 5th of January, and we're at 45 yesterday. I think we're down to 39 today in the hospital. Our case count, we're at 139.6 per day. Now we're at 52.7 and dropping. And you can see that Hawaii County, the numbers are plummeting. Honolulu County, they're down 60%. Kauai has succeeded. They have very little COVID, but they've been very close to, which is a challenge. And in the last 40 days, the rate has dropped in half in Maui too. So the case count, thank goodness, is finally going down. Now, people want to hear about vaccinations probably more than anything. So we've given 261,950 shots. That is about like 150,000 people. 100,000 people or so have had both shots, and about 60,000 have had one shot. And we're going to continue to vaccinate people as carefully and expeditiously as we can. This week, it could be a little bit of a challenge because the storms are delaying the supplies, but we're getting people vaccinated, and that's what matters most. You could see that over the weekend, we didn't update some of our data, but we'll probably be at 275,000 by the end of today of shots given. We'll be at 350,000, by the way, by the end of the month of March. We'll be at 600,000 shots given by the end of April and 850,000 shots by the end of May, at least. And this will get us rapidly to immune status, and then we'll be able to restore, some regular life, and certainly a lot of hope to have our economy start again and very low rates of COVID in the background. Here are some of those statistics. We've received 288,050 doses of the vaccine in the state. We'll get up to 309,800 very soon through our supply chain. And you can see how many administered shots we've had in different settings. This is from a week or so ago. We've also done about half of all of our kupuna. There are 109,000 people who are 75 years and older in the state, and there are another 148,000 people 65 to 74. So vaccinating all of these individuals is critically important because they have the highest mortality rate, plus vaccinating people who are healthcare workers, first responders, people in, quote, the essential workforce, although everyone's essential to me. But these categories are meant to describe like people who are at high risk and would keep like the power grid on or keep food supplies coming in, those kind of jobs. So we're trying to vaccinate them also so that they can stay working and keep Hawaii serviced, in addition to protecting our elders. Here's what 1A looks like. That's healthcare workers, 40,000 people, long-term care facility residents, kupuna living in long-term care facilities, that's 10,000 people. That's done basically. 1B, now we're deep into 1B kupuna, that's the up to 109,000 people over 75, those who want to get shots, and these close front-facing frontline essential workers, another 50,000 or so people. So that's another 150,000 people. We're well on our way to finishing these guys. And here's some of the categories: first responders, corrections people, emergency services, some government workers to keep government going and open, like to get social security checks and unemployment checks and certain things out. Critical transportation, utilities, teachers. Teachers are critically important, just like everyone is, but to get the schools open, we have to get the teachers vaccinated, basically. and then Postal Service employees. There's what 1C looks like, which we'll get to in the next couple weeks. That's ages 65 to 74, especially those with chronic illness. That's about 100,000 out of the 146,000 people have some kind of illness. And then additional people who have underlying conditions, like someone's got immune compromise or has had cancer, they'll rise up and come sooner rather than later. And then whatever other essential workers that aren't as front facing, but we still want them to be immune so industries can go forward. By then we'll be over halfway done and we should open up everything, really. We'll be safe. And when I say open up, it's if people have been vaccinated plus 2 weeks, so they're immune, we use that as the exemption. Otherwise, we use the safe travels exemptions, which I built, which was a pretest 72 hours before coming to Hawaii. That pretest is basically why we didn't get a big surge of COVID, because tons and tons of people would have brought COVID here, except by having to either go through the test, which dissuaded people, or getting a positive test that put people on the bench staying home. We really shrunk down our numbers. And most of the cases that we had from travel, by the way, were our own people coming back with COVID, just who lived here. That's just the way it was, because they had to come home. They had to, be home. So that's the way it went. And of course, Las Vegas is out there and everyone is gambling and staying close to each other and making out so that you're going to spread COVID all the time. So additional considerations. What stays in Vegas, except for COVID. It comes back to Hawaii, which is a problem. So here are some additional considerations. The vaccine distribution can go between phases. We can distribute it to the eldest first, and that's what we always try to do. Not perfect, but we try. We prioritize groups if they're more likely to die or spread the disease. And also we can do some geographic consideration if there's a big outbreak somewhere, or if it's going to disproportionately affect some group of people. So these are the main considerations. Then we'll go to phase 2, which will come probably in May. That's everybody else. And then phase 3 will be our children, our keiki. And they're asking us not to call it Operation Warp Speed yet, but they haven't given it a new cool name. So we're going to keep that for now, I guess. These are some resources I'd recommend. HawaiiCovid19.com to sign up as your category or group is in need. And if you have a business or an industry, that's where there's a website there or a link there that you basically click on and you talk about how many people you have that are qualified for 1B or how many might be qualified. And then the Department of Health, when they get there, will call you and set up a series of times to register or make appointments. Kupuna can go to a bunch of different locations across the state. And like I said earlier, organizations with frontline essential workers should complete that survey. But HawaiiCovid19.com is your very best bet. Because my wife's not here, I'll share my cell phone with you because she gets mad when I do that, but happy to do it. If you have a crisis, call me on my cell, 937-0991, 937-0991. So if it's an emergency, I'll try to get you an answer fast. Otherwise, the main stuff's on the website and you can sign up there. If people are a little bit patient, we're going to get through this really well. So, I understand that you guys in Kaka'ako have been great. It's just going to take a little bit of time, but everyone across the country is going through the exact same process. So, and I also you could do me a favor, have everybody jump on our social media. It's at LTGov Josh Green, at LTGov Josh Green. I'd appreciate that because then I can communicate in, like a 30 second or a 1 minute clip, short, a quick update, which I do most days, and give people the update of how many vaccinations we've done, what category we're in, which phase, how many cases we have, whatever the most interesting piece of information is for the day. That's kind of my approach, and we do it real fast so that it doesn't get utterly boring. And I think that's my presentation. There we go.
Mahalo, Lieutenant Governor. Just a friendly reminder, the Q&A chat is open, so please look for that question mark dialog box on your computer. For those of you joining us by phone, please feel free to email your questions to us at info@arkaka'ako.com. We'll be addressing them shortly. And now on to our next speaker. It is my pleasure to introduce Dr. Sandra Chang to discuss the vaccine science, including safety and efficacy.
Hello, everyone, and thank you very much for inviting me to speak to you all today. I will get started with my first slide. Okay, great. Oh, it's the previous one, but that's fine. Yes, so I'll be talking to you about COVID-19 vaccines today. You know, what are the vaccines that we now have? Are they safe? Are they effective? And what are we doing to be sure that we monitor safety and efficacy going forward in the community? And so, as has already been mentioned, I'm from medical school. I'm a professor there, but I'm also co-chair of the Hawaii Department of Health Vaccine Medical Advisory Group, and we work very closely with the community to inform them of the science behind the vaccines. Next slide, please. So there are a variety of different vaccines under development for COVID-19. And as you can see, you know, there are many different approaches to making vaccines. Right now, the vaccines that we have available to us are called nucleic acid vaccines, and specifically messenger RNA vaccines, and I'll be explaining those in the next slide. So that is one type of vaccine that is already approved for emergency use in the community. The second type, which is very close to approval, is a non-replicating viral vector vaccine, and I'll also speak a little bit about that. But there are many vaccines in development, and hopefully we'll soon get to the point where several of them are available for use in the general public, and we won't be dealing with shortages anymore. Next slide. Okay, so these are the two major types that we're starting out with for the COVID-19 vaccines. On the right are the nucleic acid vaccines, and I'm going to specifically go through how these work, and specifically how the messenger RNA vaccines work. So the reason why we were able to develop these so quickly is because all it took was for us to sequence the gene for a protective protein of the virus called the spike protein. Once we had that gene sequence, we could produce it in the laboratory and test it as a vaccine in animals. And so the vaccine that we're using for the messenger RNA vaccines by Pfizer and Moderna are pretty much the same thing. They consist of the RNA molecule encoding the spike protein of the virus that is enclosed within a lipid bubble. This lipid particle then can fuse with your cells once you're injected with these vaccines and release the messenger RNA into the cytoplasm or the cytosol of the cell. And this allows the cell to manufacture its own protein, its own spike protein, and release it so that it can be recognized by the immune response. And so this allows you to make a protective immune response that produces a variety of different proteins and cells that will protect you against infection. And the beauty of this particular vaccine, if you look at where the RNA goes, it doesn't go into the nucleus. It has no potential of recombining with your own DNA. And so it is a very safe vaccine. And in fact, the RNA is degraded very rapidly soon after introduction. So once you've made a response to the vaccine, it essentially disappears from your body. So it's very safe. The viral vector vaccines on the left are the next ones that are coming up. And the adenovirus is the one that is being used for the Johnson & Johnson vaccine, for example. And that one is very similar to the RNA vaccines. In this case, the gene for the spike protein is placed within a pseudovirus, which can transport the messenger RNA into the cell. And then, very much like the messenger RNA vaccine, the whole cell will make the protein and stimulate the immune response to the spike peptide of the virus. So very, very similar mechanisms and also very safe mechanisms. The beauty of the viral vector vaccines is that they do not replicate at all. They are non-replicating viral vector vaccines. So again, they're eliminated from the body very quickly. Next slide, please. And so people often ask, you know, why was it possible to develop these vaccines so rapidly? Did we cut any corners? Did we skip any steps? And the reason why we were able to do this is because we invested in two tracks for vaccine development. One is testing the vaccine to make sure that it was safe and effective, first in animal studies and then in humans. And the other track was to develop manufacturing capacity for the vaccine at the same time, so that by the time we knew that the vaccines worked, we already had doses ready to be shipped out for people to be vaccinated. It took a lot of investment from the government, and it started very early, soon after the information on the virus was released, but it's resulted in our capability of circulating or distributing the vaccine as soon as it was approved by the FDA for emergency use. Next slide, please. Okay, so I'm gonna just show you some data for the vaccines that have been approved, the Pfizer-BioNTech vaccine and the Moderna vaccines. Next slide. And so this might look a little busy to you, but all it says is these vaccines are highly effective in preventing confirmed COVID, that is COVID symptoms, as well as a positive nasal swab test. And so both of these vaccines were tested in clinical trials in tens of thousands of individuals and compared to individuals that received only a placebo or essentially saline. And it was found to protect at a level of between 94 and 95% against confirmed COVID infections. The protection was very similar, independent of the age of the recipient. So you can see the breakdown into three: the 18 to 65-year-old individuals, the 65 to 74-year-old individuals, and 75 years and older. And you can see very high effectiveness, 92 to 100% effectiveness for all of these different groups. It was also very effective against protecting against severe COVID and COVID death. And as far as individuals that have comorbidities, who may have had conditions such as diabetes that predispose them to more severe disease, they were also highly protected against the COVID infection and disease. So efficacy was consistent across age, race, ethnicity, and gender demographics. Next slide, please. As far as side effects goes, yes, you do develop some discomfort as a result of being vaccinated, and that is the result of your body responding to these vaccines. They're pretty similar, these two messenger RNA vaccines. On the left, we see the very common side effects of the Pfizer vaccine, and on the right, the Moderna vaccine. So you would very commonly expect to see headache, fatigue, fever, chills, pains, injection site pain. In many individuals, not everyone, but many individuals who get vaccinated have these side effects, but they're very mild to moderate in severity and usually disappear after about 1 to 2 days. So very transient, and it's essentially the price you have to pay to be protected against severe disease by COVID-19. Next slide. So these vaccines, as you can recall, were given approval for emergency use back in December. And the Pfizer vaccine can be used in individuals 16 years of age and older. And to date, over 25 million doses have been administered in the US of this vaccine. In the case of Moderna vaccine, it is usable for individuals 18 years of age and older, primarily because that was the age group that was tested in the clinical trial. And again, 23 million doses have been administered in the US as of February. And so as you can see, both of them have both require 2 doses, either 21 or 28 days apart. Next slide, please. So the safety of these vaccines are still being monitored and continue to be monitored by both the FDA and the CDC for safety. And so there are a variety of active and passive surveillance programs that are in place to ensure that individuals who have severe side effects are reported, so we can monitor the frequency of those side effects. And then there is also large database monitoring and individual case follow-up for individuals who may have had severe side effects. So even though the clinical trials showed that it was safe, because there are a limited number of people who participate in clinical trials, it is important to continue to monitor safety after the vaccine has been introduced into the public to be sure that there are no adverse effects that did not show up in the initial clinical trials. Next slide. And indeed, there is a side effect that was detected during the vaccine rollout in the population, and that is anaphylaxis. There has been a lot of follow-up on reports of anaphylaxis by the government-sponsored VAERS reporting system. And to date, for the Pfizer vaccine, nationally, there have been 21 cases of anaphylaxis that have been directly attributed to the vaccine, over 1.8 million first doses, for a frequency of 11.1 cases per million doses of vaccines. For Moderna, the frequency has been 10 cases in the entire country, over 4 million first doses, for a frequency of 2.5 cases per million doses of vaccines. This is a slightly higher level than what you would see for a common vaccine like the hepatitis vaccine or the flu vaccine. And for that reason, it is being monitored very closely. And when individuals go to get their vaccination, depending on their risk, they are monitored for either 15 minutes or 30 minutes to be sure that they don't develop any severe allergic responses. And so the recommendations by the CDC has been to screen recipients for contraindications and precautions against getting the vaccine and to have necessary supplies on hand to manage any anaphylactic responses should they arise. Next slide, please. So some of the questions that remain to be answered, people want to know how long will the vaccine protection last? And at this point in time, it is being monitored. We only have introduced the vaccine for about 2 months at this point. And in the clinical trials, it's been about maybe 6 months that it's been out and used in clinical trials. So we know that it lasts for at least 6 months. It probably lasts longer than that, but time will tell as far as the duration of protection goes. The other issue that has come up is the emergence of variants. And so we want to know whether it's effective against these variants that are popping up in the population. So far, it looks like it's still protective against hospitalization and severe disease against the variants, but may not be as effective in protecting against COVID-19 infection. And so we want to know whether the vaccinations prevent asymptomatic COVID infection as well as reducing transmission of this virus, and that is being monitored in follow-up studies. Can we reduce to a single dose rather than requiring 2 doses for these vaccines? That is also being studied. And then another common group of questions is the vaccine safe and effective in children as well as in pregnant women or lactating women? And so for children, trials are being planned or are in progress to test vaccine safety and effectiveness in children. And we won't know for a little while, but hopefully, as Lieutenant Governor Green mentioned, by the summer, we should have some data on our ability to use these vaccines in children. In terms of risk to the mother and the fetus in pregnant people, there is no known risk to mothers and the fetus, and it is recommended that pregnant people do get vaccinated with this vaccine because COVID-19 poses a very severe risk to pregnant women as well as to the fetus. And so it is really important that they do get vaccinated, and a pregnancy registry has been established to enroll and follow pregnant women for any effects of vaccination on pregnancy or on the fetus. Next slide, please. This slide just shows you what's coming up. So on the left 2 columns show you the properties of the Pfizer and Moderna vaccine. And as you know, it requires very cold storage, especially the Pfizer vaccine. And so there is some concern about being able to use this in conditions where it may be difficult to maintain cold storage. So some of the newer vaccines that are in the pipeline require just refrigeration instead of freezing for storage, and that's going to really help distribution of the vaccines once those are approved. For the Johnson & Johnson vaccine, it is going to be reviewed by the FDA on February 26th, and we'll see if that gets approved. That particular vaccine has efficacy of 66% overall against COVID-19 infection, 85% against severe disease, and is pretty much completely effective against preventing hospitalization and death. So that's going to be a really important tool for protecting the community in general. So those are, the coming vaccines. The Novavax vaccine just has started. It's a protein vaccine, different than the ones that I've described. And the phase 3 has started for that particular vaccine. For the AstraZeneca vaccine, they are still completing the phase 3 trials in the US. Hopefully we'll be able to get those data pretty soon. But their international trials have shown that it has an overall efficacy of 70.4% in countries such as Brazil and the United Kingdom. Next slide, please. And so this is my last slide. And I just wanted to emphasize that, there are many ways that we can protect us against COVID-19. The COVID-19 vaccine is one important tool to helping to stop this pandemic. Thank you for your attention.
So the mahalo nui for Dr. Chang for her presentation. We'll be looking at presenting the questions and answers later on in the discussion today. Up next, I would like to introduce Dr. Jordan Lee. He is a pulmonary and critical care physician at Queens Medical Center. He's also a 2000 Kamehameha School's Kapalama graduate, and he's here to provide us some insight into his vaccination experience. Jordan?
Aloha, and thank you so much for having me join you guys today. I feel honored to be on the panel with Dr. Josh Green and Dr. Chang. Very informative slides, so thank you very much for talking about that. So I was asked today to kind of speak to my personal experiences with the COVID-19 vaccine. As you know, I've been working on the intensive care unit in our COVID ICU for the last year. It's been a very challenging and somewhat heartbreaking experience, kind of seeing how the COVID-19 pandemic has played out for various patients and family members. So to witness it firsthand has been definitely eye-opening. But as Josh Green was saying, that it's been also kind of reassuring the types of tools that we have implemented, the hand hygiene, the mask mandates have all really helped in kind of squashing this pandemic. Our numbers were very, very high in August, and it was a very crucial time at that point where it felt like the hospital systems were almost on breaking point. So it's nice to know that we hopefully have light at the end of the tunnel. And as Dr. Chang mentioned, vaccine is one step or one tool that we have in our armamentarium to kind of battle this whole pandemic. So in terms of my personal experiences, as a frontline worker and healthcare worker, I was vaccinated through Queens. And this was back in the first week of early distribution, back in mid to late December 2020. Personally, it was not bad at all. The injection itself was pretty painless. I felt a little bit of tiredness and really just some injection site soreness for one day, and then it was pow. And then I was due for my second shot, which will boost kind of your efficacy from about 50% to 94 and 95%, as Dr. Chang mentioned, about 3 weeks later. And that went pretty well, actually. I just felt a little bit of tiredness, but no severe reactions, no headache, no nausea, vomiting. Was able to carry on with work the next day. So yeah, I think the vaccination process itself hopefully will be kind of rolled out in a nice platform and plan, as Dr. Josh Green was mentioning. But the process itself was pretty painless, and I'm hoping that many folks will be able to get the vaccination in a timely fashion. I know that Queens and Hawaii Pacific Health have started to kind of made massive kind of vaccination programs at the Blaisdell Center and Pier 2. And yeah, I think it's an important tool that we have to help battle this pandemic. And then personally, as a resident of Kaka'ako, so they were asking me to kind of speak to why I think it is important. I think it is an important part that we continue to practice safe hygiene and social distancing and mask wearing. It would be nice to have the vaccination on top of that as an extra layer of protection for our ohana, our keiki, our kupuna, as we all like to enjoy the outdoor arena, you know, so being able to walk outside. I live in Salt in Kaka'ako, so it's nice to be able to walk outside and, you know, just have that extra comfort of mind and safety of mind that, you know, you're protected against yourself and also your neighbors and your loved ones as well. So yeah, that's kind of my testimony to the vaccine process. Would be happy to answer any questions later about the nitty-gritty of COVID-19, but that's all I wanted to share with you today. So mahalo for having me, and imua.
Mahalo nui, Jordan. And as he mentioned, now we're going to open up the floor to Q&A, answer some of the questions that you have submitted. And helping to answer during this time, please welcome Dr. Lee Wan-Consejo Lam. We are doing the Q&A in a panelist style format, so you'll see all of the presenters here today on your screen. And we'll begin in just a minute. Aaron will be asking the first question that we received. I'll kick off the questions here. Let's see. It is a question about keiki and keiki getting vaccinated. Why do keiki have a lower priority to be vaccinated?
Dr. Chang, do you want to answer that one, or would you like me to?
Oh, why don't you go ahead, since it's more practice oriented? Yeah.
Okay.
Go ahead.
Okay, so aloha everyone. I'm Dr. Wan-Consejo Lam from the medical school, and thank you so much for this opportunity. So there's a couple of reasons. One is the initial clinical trials were not done with children. And as you heard Dr. Chang mention, there are ongoing trials, and in fact, one was announced that will start enrolling children 6 years old. But that data, you know, will be out later. The other reason why the children are not currently on the highest priority risk is that for most children, when they do get infected, they are more mild. We do know, of course, we do have severe cases. We have had cases here in Hawaii of the multi-system inflammatory, conditions. But generally for children, if they do get it, it's mild. And so with the vaccine, it's really balancing that risk of who could die from it or who could get very, very sick and end up in the ICU, and balancing that against the need to keep our government and schools and businesses and essential services running. Thank you.
Thank you. Another question that has just come in is they're asking a person asked if they wait longer than the 3 to 4 weeks recommended between getting their second dose, are there any risks to waiting longer?
I'll go ahead and answer it. So, you know, the reason why it's spaced 21 and 28 days apart is because that has That is what was done in the clinical trials. And when we say 94, 95% efficacy, it was with that spacing. Okay. It doesn't mean that if you go a few days, fewer than 21 days, for example, that you won't get a good response, but it may not be quite as high as 95%. Currently, it is allowed. You can get your second dose 4 days earlier than the recommended interval. So, 17 days instead of 21 days. So that is allowable. And if for some reason, due to, circumstances, you might miss the dose by a week or so, it's still allowable to give the second dose, and you don't have to repeat the whole thing over again. So, there is a window that is given, but the recommended interval is 21 or 28 days, depending on the vaccine.
Mahalo. We have another question that came in. If you could talk about if there's any possible side effects on the human reproductive system, and if there's a major concern if you're planning to have kids in the future.
Dr. Shan, you want to take that one, or you want me to?
I can do it. So, there is no risk with the vaccines that we have now to either the mother or the baby. As I mentioned, the RNA molecule is degraded so quickly in the body that it just has enough time to induce an immune response and it disappears after that. So there's really no chance of it integrating into your own DNA or into the baby's DNA and producing any adverse effects that way. For the pregnant women, in terms of the progress of their pregnancy, there were a few women who got pregnant during the trials, and their pregnancies are proceeding normally and they're being monitored, but it doesn't seem to have any effect on their pregnancy or on the baby itself. They have done studies in animals looking at safety of the vaccines in animals, pregnant animals, and there is no negative effect on the development of the fetus. So right now, there is no data that indicates that there is any danger to the mother or the fetus. And as I mentioned, the risk of COVID to the mother and the fetus is so serious that, it becomes a decision to get vaccinated because you don't want your child to get COVID, or you don't want yourself to get COVID and not be able to carry the pregnancy to its full term.
Thank you. Another question just came in. If you're fully vaccinated, do you still have to wear a mask in public?
Go ahead, Lee.
Yes, you do. Until we get a substantial amount of our population vaccinated, it's going to be really, really critical. And the other reason, there is new data coming out. Some of you may have seen some articles if you read the New York Times or, other studies from AstraZeneca and others showing that, the vaccines do seem to demonstrate some efficacy against transmitting it, the asymptomatic transmission. But again, these are, smaller, relatively smaller groups. And what we do know is that we really need at least 70%, probably closer to 75% of our population vaccinated before we can really feel comfortable. And the other uncertainty, of course, are these variants, right? So right now, it does seem that, the vaccines do have some efficacy against the variants, but that data is still being accumulated across the world. And so for multiple reasons, it's really important that we continue to wear our masks and practice the physical distancing and washing our hands, just like Dr. Lee mentioned before.
Yeah, and I can totally echo that as well. I think as a side note to kind of the COVID-19 pandemic, I usually work this is our typical flu season. So usually we are very busy around this time of the year, even despite having flu vaccines every year. And I have to say that we have not seen much, if at any, cases of flu in the ICU. And I think that's largely to do in part by what we are practicing right now, our social distancing, not traveling if we don't need to, our hand washing, our mask wearing. That has had a large impact on other kind of airborne and droplet infections, including influenza. So that just goes to show, like, that plus our numbers being down for COVID, that this is all very important. And again, vaccination is one part of it. But again, to get through this and until we know more information, it's important to continue doing the other practices and on top of the vaccination. So, yeah.
Mahalo. We have another question that came in. This person shares that they're on the younger side, they're healthy, they work remotely, they have zero in-person contact with coworkers or students. They're wondering if they should pass up the vaccination at this time and that those doses go to kupuna or those who are higher at risk, essential workers.
Okay, I'll take that one. So right now, because of the limited supply that's coming into the state, as you heard the Lieutenant Governor mention, the current priority is, the kupuna and essential workers. And so, and many agencies have further prioritized or sub-prioritized those essential workers who are on site in close proximity to others. And so the situation that was described means that you wouldn't necessarily be kind of up to get your vaccine at the moment anyway. And so again, that decision is often being made by the employers. And so yes, you should wait until it's your turn. But as you heard the Lieutenant Governor mention, we are hopeful that within the next several weeks, the supply of vaccine will be more steady coming into the state. And we do have that capacity already without any additional providers to get 80,000 doses in arms, per week, which is kind of where he got the 200,000 per month, number from. And so once the vaccine comes into the state more reliably, then, everyone is hoping that we can move through the 1B category. And I think you heard him mention that hopefully we can get into the 1C category, next month or by April.
Thank you. Another question coming in about the actual vaccination process. They've heard somewhere that taking Tylenol before receiving the vaccine, the shot, can reduce some effectiveness of the shot. Is it okay to take over-the-counter medications after receiving or before, or are there any side effects? Yeah,
so good questions. In fact, the CDC came out with some additional, more firm recommendations today, I think. And so the suggestion is to not take any medicines, Tylenol or anti-inflammatory medicines, naproxen, ibuprofen. Don't take any of that before the vaccine. And the reason for that recommendation is because we're really not sure if it would, blunt the immune system or blunt the immune response. And you want to give your body a chance to make as much antibodies, as possible to the vaccine. However, if, after you get the vaccine, you do feel some, many of the side effects, like Dr. Chang mentioned, are pretty mild and don't need any sort of over-the-counter medicine at all. But we do know, I was one of them, sometimes you do get a high fever and a pretty bad headache, and, you may need to take some, anti-inflammatory medicine. And if that's the case, then yes, then over-the-counter is fine. But there's consistent guidance to not take anything before you get the vaccine.
Mahalo. The next question is, why do the vaccines need to be kept so cold?
We'll let Dr. Chang answer that.
Okay. So the vaccines that we have right now, the messenger RNA vaccines, they are very temperature sensitive. And so if you leave them out at room temperature, they're just going to break down. And so it is important to store them frozen before you use them in very low temperatures, and then just keep them in the refrigerator for short periods of time as you're using the doses. And so that maintains the integrity of the vaccine itself. And so that is the reason why you need to have those low temperatures. And as I mentioned, however, it's a different story for some of the other vaccines, and that would be an advantage. And so the Johnson & Johnson vaccine and the AstraZeneca vaccine don't require those low temperatures. And so, even though on paper, they're not as highly efficacious. They're not 95% because they can be used under a variety of different conditions, and you can, reach out to different communities that may be harder to access. Those are very important vaccines as well, both for the US and globally.
And then additionally, Dr. Chang mentioned the efficacy number, but on her slide, she also mentioned the prevention of severe disease and death, which is really important. And that's what Dr. Lee, unfortunately, has seen too much of, right? And so all of the vaccines are really very, very effective against preventing severe COVID and death. And that's probably the most important number to remember. I think all of us have gotten fixated on this efficacy number and, 70 is not as good as 94. But the real number that we all really care about is the prevention of severe disease and death, because that's what's going to keep you at home instead of coming into the hospital.
Thank you. Next question coming in is about the future. Do we foresee having to get vaccinated every year?
Remains to be seen.
Yeah.
More data forthcoming. Yeah, remains to be seen. I think we don't know.
That's why the trials are being run for 2 years to take a look at that. And there's a lot of immunity studies, including some being done right here across the street from you. Here at JAPSOM is looking at those immunity studies to see how long it lasts.
Yeah, and as long as the transmission, the case numbers are down in the community, the chances of variants arising is lower. So if we can just get those numbers down, then we can count on our current vaccines continuing to be effective for a longer period of time.
Good point.
Mahalo. We've received a lot of questions about asking when the vaccine where you only need to take one shot will be available.
Yeah, that's the one that's being reviewed on the 26th of February. Keep your fingers crossed, because that is a one-shot vaccine. And so that might be the perfect vaccine for lower risk individuals like, college students and children. So we'll have to see.
So a question coming in asking for advice. Before going to get the vaccination shot, should we be going to get something to eat?
That's a good question. Medically, it doesn't matter. But logistically, the mass vaccination sites have actually been running very, very, very efficiently, considering, right, thousands of people per day. But, there is always a chance of lines, waiting in lines, right? And depending, there's that chance of being in a little bit more hot, temperature or humid temperature. And so in that case, having something to eat and having some water is good advice, because, you don't want to get dizzy because you haven't eaten for 12 hours, that kind of thing. But from a medical point of view, it doesn't, from a strict vaccine point of view, that doesn't matter. It's more your own body. And, if you've been running on fumes and you haven't slept like many doctors, and then you go and you don't eat for 14 hours and you have to stand in line, yeah, then, that's probably not a good idea. You need to eat an energy bar or something.
Yeah, and kind of on that note as well, I think if you're not feeling well that day, definitely defer your appointment until you recover. Same if you're getting vaccinations for something else. I think someone else asked if they're getting like the Shingrix vaccine. Would not recommend taking it at the same time. You don't want to overwhelm your immune system. So again, really got to go with how your body feels. So if you're not feeling well, or if you have planned to get another vaccination around that time, try to space it out so that your body doesn't get too overwhelmed with it. But yeah, definitely have a snack on board, have some water. It's been very hot out recently, so stay hydrated.
Great tips, mahalo. Another question that we've been receiving a lot lately is how does a person with an underlying medical condition who's under the age of 65 get on the list?
That is a good question. I don't think that we, meaning DOH and the whole medical community, has that exactly figured out yet. But what we are recommending folks to do is to, well, most of the time, for me as a primary care physician, I have my own list of patients that I'm waiting. I know I have them bookmarked in my medical record, and they're, you know, immunocompromised, or they have cancer, whatever. So I have my own list. And so when the time is ready, then I will be submitting that list to whomever I am supposed to submit it to. And some of our larger health systems are actually already starting to pull those lists based on the conditions in their medical record. And I think the anticipation is that they will be notified, you know, closer to when the 1C group will be eligible, which hopefully will be soon, in a few weeks. Yeah, fingers crossed.
Thanks. Another question coming in. Do you guys foresee in the near future, in August and September, when our students are going away to college on the continent, if the vaccine will be available to them?
Yeah, you know, that's a really great, that's like $1 million question. You know, we hope so, but honestly, until we have a better vaccine supply, we're just really not sure. Like right now, for example, you know, we have a lot of folks that, you know, may work in another state and come to Hawaii for temporary work, but maybe they got their first vaccine in that other state and they, you know, had to come at the second dose. Right now, all of our doses are prioritized for Hawaii residents, right? And it's just because we have so many people to vaccinate in the 1B group and not enough vaccine. So I think that does remain to be seen. I do know, though, that there are, you know, kind of individual cases where, depending what school and where and other things, that they are highly considering making vaccine available. There are some very recent studies and recommendations, not only from CDC, but also from many others, that show it's actually really important to get college students vaccinated because they are among the younger, more social group that's easier to transmit. And so I think the whole country is waiting for that day when we have enough vaccine so that that very important group can get vaccinated.
All right, and I know we're coming up on our time soon. This question came in. Do people still need to get a COVID test for travel if they've already been vaccinated?
Yeah, that's a hard one. I don't think the policies have been finalized yet. There's a lot of additional considerations, and also it depends on which test, right? And so you want to choose your test appropriately for the travel program. And you know, there is this thought about, you know, vaccine passports and other things, but I think that the data is still coming in, and really carefully looking at what's happening around the world to see whether that makes best sense from a policy perspective. So stay tuned.
The same goes. I think the same will have to be kind of considered with the variants that are coming out as well. So yeah, it still remains to be seen, and policies are still being discussed at the current time.
Well, thank you all for joining us today and sharing your mana'o to our family and our residents here in Kaka'ako and at Kamehameha Schools. We're going to be wrapping it up right now, but this video will be available for everyone to view on the Our Kaka'ako website if any residents or anyone wants to view it later. We want to thank our guests today, Lieutenant Governor Dr. Josh Green, Dr. Sandra Chang, Dr. Jordan Lee, Imo, 2000 graduate from Kamehameha Schools, and Dr. Lee Panukaseo alum. Thank you guys for joining for us today, and we appreciate it. We have a slide here we're gonna throw up right now. If there's anyone who needs more information about the vaccination or any protocols, we have it up here now. If you could. And we want to thank everyone for joining and appreciate taking the time out of the lunch hour to spend with us. Mahalo.
Bye.
Hello.
Have a great day.